Well, more details starting to emerge about how the vaccines will be rolled out in different parts of the country. The Kwazulu-Natal Premier, Sihle, Zikalala, the Health MEC, Nomagugu, Simelane-Zulu, announcing plans for the vaccine campaign there. Our reporter, Corinda Jacques-Mahan, she is at the St. Augustine's Hospital in eThekwini, Durban now. Corinda, good afternoon to you. What are the Premier and the Health MEC saying?
Good afternoon to you. Well, so far we understand that a vaccine coordinating committee has been established, and this is going to oversee the management, distribution and dispensation of the Covishield vaccines. They're expected to arrive in KwaZulu-Natal around the 14th of February. We know some of them are currently being sampled at various labs across the country, and then we expect them to arrive here. So far we understand that for the first phase or the first rollout of these vaccines, 163,256 health personnel are eligible to actually take these COVID-19 vaccines in the first phase. These are health personnel from various sectors across the province. And just to put you better in the picture, in the public healthcare sector, there are over 81,000 staff there that are eligible to take this vaccine. And in the private healthcare sector, you've got just over 49,000 staff that are eligible to take this vaccine. The KZN Health MEC also saying that no one will be forced to take this vaccine, as well as healthcare workers. They'll not be forced to, it's their choice. But so far, they've created a registration system whereby they'll be able to see who exactly is getting these vaccines, especially because we expected to see further phases and further rollouts of the Covishield vaccine. Now, there are, more discussions around how this vaccine is going to be transported here as well as stored. We've heard so far that 91 facilities in KwaZulu-Natal have been identified to store these vaccines as well as to carry out these vaccinations across the province. In KwaZulu-Natal, we have 11 districts, and we understand that there will be facilities across these districts for healthcare workers to go and get their inoculations. We also understand that there will be a high security contingent that will actually accompany these vaccines as they come from the national offices or national storage facilities to KwaZulu-Natal and other provinces as well. Now, just to take you back to that vaccine coordinating committee, it's comprised of various stakeholders, including many stakeholders in the health sector, but as well as faith-based organizations, NGOs, municipalities, as well as we understand traditional leaders and the South African Military Health Services. This is to ensure that the province can really have a well-rounded well-rounded members in this committee to ensure that this vaccine rollout can happen as smoothly as possible. We do also understand, just speaking about the way that COVID-19 has been spreading across the province, one of the major concerns that the Premier has raised is about the death rate statistics that we are seeing. Now, KwaZulu-Natal has among the highest number of active cases per province in the country, but one of the more worrisome concerns at this point is that over the past 2 weeks, the average number of deaths per day because of COVID-19 were at 75. And this, they say, was recorded by analyzing the number of deaths on the day that the person died and not on the day that it was reported. But shocking statistics coming out of the numbers that we are seeing, and at a time when the vaccines have just arrived. We understand that so far the prioritization will be of healthcare workers who are in direct contact with COVID-19 patients in hospitals and clinics and facilities like this one that I'm standing outside of, where we saw at the start of the pandemic many healthcare workers actually being infected with COVID-19. We were here for quite a while discussing how the virus had spread at this hospital. So at this time, of course, healthcare workers must be feeling, more protection for them as they see this priority given, especially to those who are in direct contact with the COVID-19 patients. And afterwards, the other healthcare workers who are not necessarily directly in contact with COVID-19 patients